To help our patients, Mount Sinai developed a CHF Bundle, which is essentially a tote bag that's filled with some great tools to help our patients monitor their CHF. So for example, in this tote bag, we have a measuring cup, which will help them calculate their intake. We have a pill box, which will help with medication compliance. We have a notepad to help with recording intake. We have a heart failure book, which will be in English and Spanish, which has some great education on CHF. And we also have a weight scale, which will help monitor the patient's weight. This CHF bundle can be obtained from 7th Center. When educating our patients and their families, it's important to let them know the signs and symptoms of worsening heart failure, which are swelling in the legs or ankles, shortness of breath, difficulty with exercise, distended abdomen, loss of appetite, difficulty sleeping or needing to sleep with multiple pillows, and rapid weight gain, 2 pounds in 1 day or 4 pounds in 1 week. Please make sure your patients know these key points about weight. If they note that they've gained 2 pounds in 1 day or 4 pounds in 1 week, that's a red flag. They should notify their provider. Please make sure they know the most accurate weight is done in the morning before breakfast. And when taking their weight, they should use the same scale, the same clothing, and take the weight at the same time every day. They should also be writing down their weights so they could trend their weight, see if they're gaining weight, losing weight, and this list of weights should be brought to their doctor's appointment. Have them notify their physician if they notice a significant weight increase. The provider might have to adjust their medications. And if you notice that the patient doesn't have a weight scale at home, please provide them with one. Now, regarding fluid intake, please make sure your patients know that they're going to be on a fluid restriction. It's usually going to be 1.5 liters of fluid a day unless otherwise directed. And they have to monitor all fluid intake, not just water that they drink. Ice cream counts, jello counts, coffee counts, soda counts. So to help them quench their thirst, there's some alternatives. They could use chewing gum, have frozen grapes, freeze juice in ice cube trays. That usually helps. And one other big thing, please make sure that they save enough fluids for when they have to take their medications. Now, CHF patients are only allowed 2 grams of salt a day, which is around 1 teaspoon a day. Please make sure that they watch out for sodium hidden in their food, such as fast food, frozen foods, processed meats, snack foods, canned vegetables. If they really need some type of seasoning on their food, there's an alternative. They could use Miss Dash, pepper, basil, bay leaves, and other herbs. Now, regarding your medications, please inform your nurse or your doctor if you experience any side effects, but please do not stop taking your medications unless instructed by your provider. Please make sure to use this pill box. It's going to help you be more compliant with your medications, which are very important. And we also want to make sure that you understand the medications that you're taking. So if you need some clarification, please just ask your doctor or your nurse. Also, please be aware that every medication has some kind of side effect, so please make sure to ask your nurse or your doctor for those side effects so you can anticipate. Now that you've been discharged, it's important to follow up with your appointments. During those appointments, it's going to be important to tell your doctor how you're progressing at home. Are you having any side effects, any symptoms? Those are going to be some really important things to discuss with them. Please make sure to bring to your appointment your discharge instructions and your daily weight list. This could be all very important because it's going to help the provider decide how they're going to adjust your treatment, adjust your medications, for example. And finally, there's a CHF class that's provided by 7th Center. It's available on Monday to Friday at 2 p.m. in the 7th Center Patient Lounge. It's meant to help educate patients and their families regarding lifestyle modifications, regarding CHF. Please attend. Hey guys, thanks for watching. Now, just note that the CHF in-service was done in multiple videos, so make sure to sign all the attendance sheets after each video to get credit for this in-service.